Adenoviruses are common viruses that usually cause a range of mild symptoms, much like the cold or the flu. Here to tell us more is Nurse Christina Paris from the VA. So good morning, Christina.
Hi, good morning.
So can you tell us more about adenovirus and what exactly it is?
Sure. So the adenovirus, and not to get anybody tweaky, because I know we've heard a lot about viruses,
Yep, thank you.
but it is another type of illness that causes, similar to the common cold. And the adenovirus, it's very contagious, similar to the cold and flus that we've heard, and so they can tend to be you can tend to have outbreaks in like schools or even in the military in basic training. So those who have gone there. It's not, again, not a serious virus, but for people who are having issues, they're immunocompromised, they've had transplants or stem cells, those people might have more difficulty with it.
Gotcha. And so what are some symptoms that we should be looking out for?
So symptoms you're going to see, just like any other cold and flu, you're going to have fever, sore throat, runny nose, cough. You might have some ear pain. You might get pink eye, so have some conjunctivitis in there. Diarrhea, you might have a hoarse voice. Those are all pretty common with all viruses.
Interesting. And so when should we be concerned enough to call our providers about these adenoviruses?
So this one, fevers. So you want to watch for fevers, especially, again, children are more susceptible to this than adults. So a fever really greater than 100 or 101 or 102, you want to maybe contact your provider. I know we're in healthcare, we kind of want to keep people out of the clinics if you're having cold or flu symptoms, but please don't hesitate to call. That's what we're there for. We can answer questions and help guide you. So really any kind of fevers or seizures due to fevers, things like that, you want to contact your provider.
Okay, that's good to know. And so when we do need treatment, what are some treatment options for this?
So with treatment options, it's really more you're just trying to treat the symptoms and supportive care. So, but you can also, prevent. Best ways, wash your hands, clean counters, sinks, surfaces, wash your towels, bed linens, pajamas, personal items. Wash your masks. Please, 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 everyone, even now, regardless of whether you're watching out for the adenovirus or the coronavirus, you want to make sure that you're washing your masks. Not the disposable, of course, but the cloth ones. But those are things you can do.
Definitely a great reminder to wash our masks. I think it's something that we can forget about pretty frequently. But by your description of this, it sounds a lot like the COVID-19 virus, right? So is there any connection between the two?
So it does, I know. So we do have these big viral groups. We have the influenza virus that we talk about. We've had the coronavirus that we talk about. Both of those are very contagious, but those two, the influenza and the corona, can be very deadly too. Those can have really serious side effects or serious significant things. The adenovirus, though, is, while just as contagious, it's a little less dangerous. And so that is why actually AstraZeneca and Johnson & Johnson, these new immunizations that will be coming out, AstraZeneca is out right now in the UK, and they're hoping Johnson & Johnson vaccine will be coming out soon. Those use the adenovirus and so that our body will develop this immune response. So that's what it's based on. So, yep, a lot of connections there.
Very interesting, and it's very cool that we're learning about new viruses through ones that have been around and we've already been used to dealing with. Well, thank you so much. That answers all our questions this morning, Christina. We'll talk to you next week.
Sounds good. Stay safe.
You too.